When most of us think of acne, we think of teenagers, but there are plenty of grown-up women who suffer from acne too. So what's the best way to get rid of adult acne? Cosmetic dermatologist Dr. Paul Jared Frank is here with some answers. Good morning to you. Good to see you.
Thank you.
You know what? I sailed through adolescence with nary a pimple. Then I get to adulthood, and all of a sudden I'm having big-time acne problems. Is that pretty common with women?
I would say about 90% of my patients that come to my office that are women, they say the exact same thing. I never had it as a teenager. Why now? And everybody wants a reason. Yep. Most importantly, a cure.
Yeah, what is the reason?
Mostly hormonal fluctuations. I mean, all teenagers go through their bouts with hormonal changes, but women, because of their natural cycle, it prolongs into their adulthood.
Yeah. I can remember, let's see, what have I tried? Accutane, Retin A, I've done topical cream, I've done practically everything. What's the best thing in terms of...
There really is no best. You know, there are several options. We have to find something that's going to be ideal for the patient. Fortunately now, we have several new technologies available for that niche of people who didn't respond to traditional therapy.
Which are like what? What are some of the new things on...
Mostly laser-based options, at-home devices, laser-based things. There are several options now. In the last 5 years, we've really come a long way.
When you say laser-based, are you talking about the laser resurfacing or laser peel? Or
Well, there's several. It's basically using light as a form of heat in ways to kill acne. Laser is more of a generic term.
Photodynamic therapy, is that one of those? And what exactly is that?
Photodynamic therapy utilizes a chemical, what we call a photosensitizer. It kind of smart bombs the sebaceous glands. You rub it on the skin for about a half hour to an hour. You let it sit, and then you run a laser, which really allows us to target the acne specifically.
The sebaceous gland, is that where...
That's what we're targeting.
That's where the pimple starts?
That's pretty much where it is. It's attached to the hair follicle.
Is that expensive, that procedure?
It can run about $650 a treatment. And
how many treatments do you need?
Most people need about 2 or 3 to keep them clear, 80% clear for about 6 months plus.
80% clear for 6 months. Okay. You also have another one called MedLight laser?
MedLight. MedLight is one of the older technologies before we had this photodynamic therapy. It really required almost bi-weekly treatments for several months at a time. So it really, the patient had to dedicate a lot of time in the doctor's office. We tend to use the photodynamic therapy more efficiently now.
Yeah. How does laser work in people whose skin is darker? Because I've always heard that that's a little bit problematic.
Well, you have to be very careful. Fortunately, a lot of the newer lasers, they see right through the top layer of the skin where the pigment is, so it doesn't cause any burning trauma.
One of the issues I had when I was having all of these problems in my early 20s was I would have cystic acne. Yeah. What exactly is that?
Cystic acne is when hormones create a susceptibility to inflammation where bacteria really take advantage, and it creates like a little mini infection, and it can be painful, scarring, and this is where
unsightly.
Unsightly.
Let's not forget that.
And this is where the new technologies are really, hopefully going to improve the situation for people.
Because what I used to always have to do would go to the dermatologist and they would have to shoot you with a needle, but now you have this. This is called Xeno?
Yeah, it's a new at-home therapy that will hopefully do what the cortisone shot will. It actually delivers a very controlled amount of heat for 2.5 minutes through the top, and you just basically place it on the skin. You hold it there for about 2 or 3 times in over a 24-hour period, and it can do what a cortisone shot does. It decreases the size of the pimple.
Is that expensive?
I believe it's $250. There's a 90-shot treatment tip that I think costs $35.
Oh, now look at this. Is this what happens?
Yeah.
So at the left there is what it starts out like, and the right?
And this is about 24 hours later.
What is the time lapse there?
About 24 hours, yeah.
That's good.
Yeah, it fits right in your pocketbook.
Oh, yes. And then, of course, there's always the old standby cortisone if you can't do something like that. Dr. Paul Jared Frank, thank you.
Thank you.
Good. New hope for an old problem.
Absolutely.
Appreciate it.